if you are struggling with recurrent UTIs or you have a UTI and you're trying to figure out what the heck is going on, how can I take care of this without flooding my body with antibiotics, ruining your gut health, then you are going to want to keep watching this to understand what's happening in you and how you can prevent it in the future. Keep watching. Welcome back to Essence of Earth. I am your hostess with the mostest, Miss Nikita. And over here, we're going to talk about everything that's going to help you improve the quality of your life. Now, I do like to just jump right into the subject at hand, but I want to invite you to subscribe to my YouTube channel and join this community. Like I said, every day we're talking about ways that we can just improve our lives so that we can have an enjoyable life as we get older, because that is the inevitable, right? So if you like stuff like that, please join my community, hit the subscribe button, click the notification bell so you'll be notified every time that I post. And also remember that any supplements or anything that I'm talking about, I do link them in the description box below, because I am an affiliate with Amazon. So I find these products that I like and I post them. I'm not going to just post something that I haven't tried or I'm not familiar with. I stand by them. I like to jump right into the topic at hand, and we're talking about UTIs. Like I said before, I'm in a lot of these groups, and something that comes up constantly is UTIs. How do I get rid of it? Why do I keep getting it? So I felt like this would be a great opportunity to break it down, right? So how you can take care of it and prevent it from coming back. So first and foremost, a UTI is just a urinary tract infection. It's infection somewhere within the urinary tract, the urethra, the bladder, the ureter, or the kidney. So if it's in one of those four areas, you can experience some very unwelcoming symptoms, okay? So now that we understand that, so some of those common symptoms are like burning, the urge to have to use the restroom, and then when you go, it's not a lot of urine, cloudy, bloody, it can smell really bad, it can have some pelvic pain or even lower back discomfort. And usually if you're older and you get a urinary tract infection, unfortunately, it can cause really like confusion, and they can be discombobulated. They can act very different because it does affect the brain. And it can also make you feel fatigued as well. So those are some of the signs. Now, urinary tract infections are more prevalent in women. Why? Because we have a shorter urethra, and it is easier for the bacteria to access that urethra because it's so short in women. So if you're dealing with poor hydration or hygiene, a lot of diabetics can get UTIs frequently, sexually active individuals, and unfortunately, I know we can't control this, but postmenopausal women. Okay, so as you get older, things start to change, your microbiome changes, and unfortunately, that's just something that may happen, that you may experience. Now, what is causing the infection, right? You want to know what that is, and it's just a bacteria. And I know I say it's like just a bacteria, but it's more than just a bacteria, but it's E. coli. Now, when I realized that it was actually E. coli, I was like, well, what the heck? I thought E. coli was something bad, or something that you catch and you just don't feel good, like you could die from it. But actually, there are two different types of E. coli. There's a pathogenic kind, which is the bad kind, and then there's a non-pathogenic kind. Now, E. coli lives comfortably in our gut, right? So it is going to help us digest food, and it's harmless unless it starts to travel. Once it starts to travel is where problems arise, obviously. So then there's also the pathogenic kind, and there are certain strains that can cause serious illnesses, and like UTI causing E. coli, which comes from the gut and the rectum, but it travels into the bladder. Right? So usually when you have this bacterial infection and it goes for a long time, it can reach your kidneys, and it can be really bad, and you'll actually need to go to the doctor to get that taken care of, to be looked at, because you don't want infections to keep traveling and really getting deeper into tissues and organs and things like that, vital organs. One way as a woman, how can you stop this from happening? You have to take care of your vaginal hygiene, right? Because the urethra is shorter in women, you want to make sure that you're wiping front to back and not back to front. And I know that's something that's probably common, and you think that some people, that most people should know that, but unfortunately, a lot of women, aren't taught that. And we can't live inside of this bubble thinking that everybody should know and have good teachers in our lives that are going to teach us these things. And not everybody has the same experience. So we can't be judgmental in that. But I know it sounds common, but for some people it's not. So I feel like I still need to say that. Now, sexual activity. After you have sexual intercourse, you want to make sure that you urinate so that you can get any type of bacteria or from the rubbing action that you may get, and depending upon, the positions y'all doing and stuff. Okay, girl, do your thing. But you want to make sure that you urinate afterwards so that bacteria isn't just sitting there. Again, because we women, we have a short urethra, so we have to be conscious of that. So you make sure that you urinate after sexual activity, and wearing tight clothing and synthetic underwear. And also wearing poor hygiene and wearing dirty underwear. So making sure that you're clean, if you're dealing with discharge or something like that on a regular basis. I mean, you can wipe up and, change your underwear and stuff like that if you have to. How imbalanced vaginal flora contributes to UTIs. The loss of good bacteria, right? Lactobacillus. So, I mean, you can take these probiotics as well, right? You can take these probiotics and it'll help you, and it allows the bacteria like E. coli to thrive. So if you don't have that bacteria, lactobacillus, then that's a probiotic that you can take, but it is like one of those defense type of bacteria that kind of keep E. coli at bay. So you want to make sure that you have that. And if you have taken, antibiotics and stuff like that, then you may not have some of these vital bacteria that you need in your gut. So taking some good bacteria, probiotics are essential in this case. Now, there are some other contributing factors like dehydration. The less urine that you have, the less you are flushing out that urethra with urine, which can flush out that E. coli when you urinate. So if you're not drinking water, you're not flushing frequently, and it can cause a UTI. Like I mentioned before, antibiotics, right? So if you've taken antibiotics, it doesn't care. It's going to take care. It's going to wipe out good and bad bacteria. So you really want to introduce more bacteria into your gut if you know that you've taken antibiotics at some point in your life, or you've taken it for a long time. Okay. Hormonal imbalances. I have a great Repro formula. I'll link it below. But that is really good if you're struggling with hormonal imbalance. And if you're holding your urine for too long. So you don't want to do that either. Now, if you start getting a lot of pain, and you start to get blood in your urine and a fever, like I said, in elderly people, when they get it, they can experience confusion, mental fog. They can become a completely different person. Like I said, because in some of the studies that I saw, the bacteria can travel to their brain, right? And it just kind of makes them act a little different. So you want to be careful in those. But if you're experiencing that, you may want to go to your doctor, okay? And they may put you on antibiotics. But you want to make sure how serious this is, right? Because you don't want anything happening with your kidneys and stuff like that. So you want to at least get that, taking a look at it. If they put you on antibiotics, just know, friend, you're going to have to do the work. You're going to have to put them bacteria back into your gut, okay? So antibiotics, they are effective short term, but they contribute to yeast overgrowth, candida, and stuff like that. And then the pain medications, they're just not good. So first and foremost, you're gonna have to drink water. Okay. And some people say, water is nasty. Water, it makes me feel sick. Why? Because you don't drink it. Oh, you could be drinking it, after you eat it, you feel full and you feel nauseated. But you got to drink water, friend. Do you know that your body, the percentage of your body that is comprised of water, like you need to drink water. So drink some more water. And then there's this thing called D-Mannose. you can take that if you have a UTI. So what D-Mannose will do, the E. coli like to stick to the urethra. It like clings on to it, right? So the D-Mannose is going to go in and it takes that sticking mechanism away from the bacteria so that it can be flushed out when you drink water. So if you're going to take the D-Mannose, honey, you better make sure that you drink water, because once it does what it's supposed to do, then it can flush it out. Okay, and like I said, you're going to have to introduce probiotics back into your gut, especially if you were given antibiotics. So L. reuteri, lactobacillus, I can't say this word, but it's right here. I can't say it. Okay, my tongue won't let me. And then there are herbs like uva ursi, uva ursi, marshmallow root, corn silk is really good. And a lot of people don't realize that, but when you get a piece of corn and you have to pull all that stuff off, that's actually corn silk, and it has great medicinal properties for the kidneys. So you can keep that and steep it. So anytime you eat some corn, go ahead and steep that corn silk and drink it as a tea, okay? Parsley, goldenrod, and make sure you're urinating after sex. Wear breathable cotton underwear and avoid sugars and processed foods. It will help you in the end, friend. It's gonna help you in the end. But this is UTIs, and like I said, it's kind of simple. It's just a bacteria, and we have to get rid of it. And I know cranberry juice is good as well. I forgot to mention that. Cranberry juice. But yeah, do all those things. And if you get recurrent UTIs, you want to look at that checklist, right? Look at that checklist. Am I practicing good hygiene? What type of underwear am I wearing? How tight are my clothes all the time? Am I urinating after sex? Am I wiping from front to back? Do this little checklist to make sure. Am I drinking water? Am I staying hydrated? Am I, consuming too much processed foods or too much sugar? Or am I drinking too many sodas? Y'all drinking all that soda and all them juices and all of them energy drinks. Okay? You get these UTIs, you gotta look at that. Okay? So if you have recurrent UTIs, look at that checklist, friend, and see, okay, I could do this better. I can do this better, because having to go through this time after time after time after time again, this is causing some kind of damage, friend. Okay? All right. And when we experience these symptoms, remember there are signs. There are signs of something that could turn into something bigger if you don't take care of it. So when you see the sign, nip it in the bud, correct your actions so you can prevent these symptoms and harsher symptoms in the future. I hope this was a blessing to you. And if it was, go ahead and subscribe again. Join my community. Click the notification bell so you'll be notified every time I post. I hope it was a blessing. Bye.